For our presentation, we will be doing Canavan disease. Canavan disease is a rare inherited disorder that damages the ability of nerve cells in the brain to send and receive messages. This genetic disorder is one of a group of genetic disorders called leukodystrophies. Leukodystrophies disrupt the growth or maintenance of the myelin sheath, which is the covering that protects nerves and promotes the efficient transmission of nerve impulses. There are two forms of Canavan disease. The first form is infantile. This is the most common and most severe form of the condition. Infants appear normal for the first few months, but by 3 to 5 months, problems with development become noticeable. These infants usually don't develop motor skills. The second form is juvenile. This is the less common form. Affected individuals have mildly delayed development of speech and motor skills starting in childhood, but these delays may be so mild that they're never even recognized. Life expectancy for people with Canavan disease varies. Most with infantile only live to early childhood. People with juvenile form do not appear to have any shortened lifespan. Although there are two forms, infantile is the most common and the most severe, so we are going to focus on this form for our presentation.
The symptoms for Canavan's disease can be identified by a simple prenatal blood test that screens for missing enzymes or for mutations in the gene that controls aspartate. The public health impact for this disease is that fewer than 100 cases have been reported. Prevalence of Canavan disease in the general population is unknown, and among people of Ashkenazi Jewish descent, the disease affects approximately 1 in 6,400 to 13,500 people.
The scientific article we chose was published by the American Journal of Neuroradiology in April of 1990. It studied CT and MR images of two siblings, one male and one female. This longitudinal cohort study reports a correlation between MR and CT images of both cases. The images shown below are figures from the case displaying the gradual loss of white matter in the corpus callosum. Another dysmyelinating disorder known as Alexander disease shares clinical similarities with Canavan disease, which becomes a problem in diagnosis. This study found that in the absence of a brain biopsy, CT images of Alexander disease show a frontal lobe predominance that is concentrated around the occipital region of the cerebellum, while CT images of Canavan disease show diffuse in the corona radiata.
Treatment. Canavan disease causes progressive brain atrophy. There is no cure, nor is there a standard course of treatment, but research is ongoing. Treatment is symptomatic and supportive, based on the specific needs of the individual. Prognosis for Canavan's disease is poor, and death is likely before the age of 10. Metabolic therapy to provide a missing acetate and enzyme therapy have yielded encouraging results. The goal is to reduce symptoms with medications called anticonvulsants. Here's an elevator conclusion and a simple way of breaking it down. It's a rare inherited disease affecting an infant's nerve cells. This disease is apparent between 3 to 6 months, and its common symptoms include a large head and impaired motor skills. There is currently no cure. Haiku. Affects cute babies. Large head. Seizures and no cure. Don't marry the fam.